I wanted you to just do a quick tell about the difference between the pre-jowl implant that I have, that
Yes.
had surgery with you,
Yes.
and a chin implant.
Sure.
Because that's something that people talk about, and a lot of people don't know about the pre-jowl implant. And so go ahead.
Sure. Okay. So let's start with the chin implant, because that's pretty easy to understand. Chin implants, the general idea is to alter the projection and or the shape of the most prominent part of the chin. A pre-jowl implant is made of the same material. It is placed in the same way through an incision under the jawline, but rather than augmenting the projection of the chin, it is designed to augment the jaw in the area just lateral to that, which is the pre-jowl sulcus. And for many patients where that is kind of deep, even releasing the mandibular cutaneous ligament in a deep plane lift won't always fully correct that without adding some volume there. And there are a couple of ways to do that. You can do it with filler, the volume augmentation. You can do it with fat. You can do it with a pre-jowl implant. All of them work. The advantage of the pre-jowl implant is that it's permanent. And, the other things are not completely permanent. You're basically altering the shape of the bone to take up that little, lack of space there. And it's interesting you bring that up, Mary. I didn't know we were going to talk about that tonight, but this has been this past year, we've been arguing about mandibular cutaneous ligament at meetings a lot, and and to what degree it actually exists and how important is it, and should we be filling that space versus surgically releasing the ligament. And anyway, it's a area that does get talked about a bit. It depends on the patient, but in folks who have a really significant difference in tissue thickness between that pre-jowl area and the jowl itself, if I feel like that I can't fully correct it with release and lifting, I think pre-jowl implants work great, and they really don't take a whole lot of extra time to put in, and it's a permanent solution.